Good morning, good afternoon, and good evening, everyone, and thank you for joining us today for this webinar. The topic for today is shock-responsive social protection in Latin America and the Caribbean, and we'll be discussing recent regional experiences emerging from a study that OPM has been conducting alongside the World Food Programme. And if we can go to the next slide, we've got two panelists with us today. You should be able to see them already, Francesca de Ceglie and Rodolfo Beazley. I'll be giving you a bit more details on their profiles in a minute. But before I do that, I wanted to just remind you that these webinars organized by socialprotection.org, they have kind of an interactive feature by which you can use the chat bar in the GoToWebinar dashboard to interact with us, to ask any questions that you may have once the presentations are finished. So if we go to the next slide, this is me. I'm Valentina from OPM. I work in OPM's poverty and social protection portfolio, and I kind of, in recent years, I've been working a lot on data and information management for social protection, and I've been supporting the last phases of this study on shock responsive social protection in Latin America and the Caribbean, and I've also been involved in the DFID global study on shock responsive social protection, which underpins this study in terms of conceptual framework. So that was the starting point from which WFP reached out to OPM to work in the region to dig further into case studies in the region, and Rodolfo will be telling you more about that. If we go to the next slide, Rodolfo is a colleague who works within my team at OPM. Prior to joining OPM, he was working for the Argentinian government and for the World Bank, but he's been with us for several years now, and he's been team leader on this project on shock responsive social protection in Latin America and the Caribbean, alongside my colleague Ana Solarzano, who is not with us today, and alongside Francesca de Ceglie, who's been working for WFP now for 14 years. She's currently based in Panama, where she's the social protection and school meals officer there. She's been working in social protection related roles in the past in Cambodia, in South Darfur, and she has been leading the study from the WFP side. So it's going to be a pleasure to have them discuss the findings today. So we'll have Rodolfo give us kind of an initial in-depth, deep dive introduction to the findings to date, and then Francesca's going to give us kind of additional insights from the WFP perspective supporting shock responsive social protection in the region. So over to you, Rodolfo.
Thank you, Valentina. Thank you very much. Thank you everyone for attending to this webinar. Okay, so as Valentina mentioned, I'll share with you the preliminary findings of this ongoing research on shock responsive social protection in Latin America and the Caribbean. Next slide, please. So I'll start with the agenda. Next, please. So I'll start by describing briefly the context that motivates this study. Then I'll describe very briefly the study, and I'll share with you the theoretical framework that guides the assessment of the role of social protection in emergency response in the region. And then I'll share with you the key and preliminary findings of the study and some final remarks. Next, please. Next, please. So I'll start with the context. Latin America and the Caribbean is a region that is exposed to natural, economic, and political shocks. The frequency and the number of natural disasters has increased substantially, massively in recent decades, as in the graph representation, and therefore it's a region that is exposed to, and is at risk and exposed to different types of shocks. No? Next slide, please. So on the other hand, social protection systems, national social protection systems in the region have been expanding, improving substantially in recent years. The investment in these programs has been increasing. Programs have expanded coverage. They have strengthened the systems and processes. They have created administrative capacity to implement these programs. No, and programs with different objectives and trying to provide different kinds of support. No, next slide, please. So in this context, in which on the one hand there are a number of shocks affecting the region, and therefore the region is at risk, and on the other hand there are relatively advanced social protection systems, we can ask ourselves if social protection systems that are meant to provide support to people in need can play a role in responding to emergencies, and have been playing this role. So this is kind of the question that motivates the study. Next slide, please. Okay, now I'm going to describe very briefly the research that we're conducting with WFP. Next slide, please. So why do we need a regional study? Not only because of the context that I have just described, but also because there is a lack of evidence about the experiences of social protection systems in the region responding to emergencies. There are different experiences, as I'm going to share with you in a few minutes, but many of them haven't been documented, and there isn't a regional recollection of evidence, no? And since there are a number of global debates about this role, we think it would be good to link Latin America and the Caribbean to global debates, and in order both to contribute and to learn from what is happening in the globe, no? So this is the reason why we're conducting the study. The main research questions is what factors would enable national social protection systems to become more flexible and more responsive to shocks. There are a number of different reports. Some of them are already available. There is a report describing the theoretical framework and the literature review that is already available. Then we are conducting 6 case studies in different countries, and there is a synthesis report summarizing the key findings and providing policy recommendations. And we have also organized a few weeks ago the first regional conference on shock response and social protection in Latin America, that was organized by WFP and the government of Peru. Next slide, please. Okay, now I'm going to describe quite briefly the framework. Next slide, please, that guides this study. We split the framework into 2, preparedness and response, even though I mean we refer to this area of work as shock responsive social protection. We also care about how systems are prepared in order to be more responsive, not just how they respond. No? So we split into preparedness and response. Next slide, please. So in relation to preparedness, systems have been, social protection systems in the region and elsewhere are designed for reaching certain or achieving certain objectives, and therefore they are prepared for those objectives. Click. So click again. So for example, there are systems or subsystems with objectives related to reduction of chronic poverty. Click, please. Support across the life cycle, like for example, child grants or social pensions. Click, please. And another objective could be risk management and social protection. And of course, systems are prepared to achieve different objectives, and how they are prepared relates to those objectives, and there is an intersection between these different objectives and how systems are prepared, but not every area in this diagram coincides. So what this means is that systems may be prepared for one objective, and that doesn't necessarily mean that they are prepared for achieving another objective. Next slide. Next, please. So in terms of preparedness, we focus on three key systems and processes. One is targeting, that is identifying and selecting beneficiaries. Click. The second one is delivery, that is transferring cash and in-kind or in-kind benefits. Click. And the third one is coordination and financing, that refers to aligning resources and actors for an integrated response. We focus on these three systems when we analyze how prepared social protection systems are to respond. Next slide, please. Okay, so based on the theoretical framework that has been developed in the OPM defeat study at global level, we see that there are different ways in which social protection systems tend to respond to emergencies. The first one is what we call vertical expansion, and you may already be familiar with this. That is this simply increasing the value or duration of benefits for existing beneficiaries and recipients. This is basically giving more to the same people. Click, please. Then the second type is what we call horizontal expansion, that is expanding the coverage of a program in response to an emergency. This is increasing the number of beneficiaries. Click. Then the third type is what we call piggybacking, and this means a humanitarian agency or a government responding to an emergency, piggybacking or using a process or a system of the social protection system. For example, this is the humanitarian agency responding to an emergency, but doing the targeting using the database of a national social protection program, or delivering cash or in-kind transfers using the delivery mechanisms of the of a social protection program, like the school meals, for example. Next one, click. Then the other one is what we call shadow alignment. That is a response implemented by a humanitarian aid, but that runs in parallel to social protection. And what do we mean by this? It's a response with two objectives. On the one hand, responding to the emergency and providing the support required, and on the other hand, investing in strengthening the capacity of the social protection system for responding to future emergencies. And this by implementing a type of response that could be adapted or replicated by the social protection system at some point. So the way the response is designed, it takes into account the characteristics of the social protection system. Next one, please. And then the final one, refocusing, means that when there is a shock, there may be a need to refocus the existing resources, and so program rules may change to focus on, for example, a particular segment of the population that is considered a priority, like, for example, children. No. So next slide, please. Okay, so next one, please. So the target here with this slide, what going to show is the targeting challenge of short response social protection and how it's related to the information available, and to show how these different types of responses, horizontal and vertical expansion and piggybacking, they may be applied. So let's imagine that there are databases of program beneficiaries in this yellow circle. Let's click. Then there are other databases with both with beneficiaries and with non-beneficiaries, like for example social registries that have information and data about both beneficiaries and non-beneficiaries. Click. And then there is a segment of the population that is not in any of these registries. No? Click. So what we can see now is that shocks may affect these different three segments of the population. Can affect program beneficiaries, can affect non-beneficiaries that are included in databases, and can affect non-beneficiaries that are not included in databases. Click. So the challenge is how to reach them. No? So in relation to point A, a vertical expansion in which the value or duration of benefits is increased can be a way of reaching those in point A because they are already beneficiaries, or piggybacking, this is government or humanitarian aid, responding using the database of beneficiaries. Click. Then how to reach those in point B? They can be reached through the horizontal expansion of existing programs, and the fact that there is already data available about these households could be useful, if depending on the type of data, in order to reach them more easily, or a piggybacking type of response using this non-beneficiary database. Click. And then the challenge in relation to point C could imply a horizontal expansion of a program, but there would need to be a process for collecting data and targeting those who are not in any database but have been affected by a shock. So this shows quite briefly how these different strategies of horizontal, vertical, and piggybacking can be implemented. Next slide, please. Next slide, please. So now we move to key findings. I'll start with response, and then I'll move to preparedness. In relation to response, and by type of shock, the experience so far has shown that most responses in the region, in Latin America and the Caribbean, have been responses through national social protection system, have been responses to economic shocks. Many of them in relation to the global financial crisis of almost a decade ago. Other experiences in response to disaster, both slow and rapid onset ones, and I'm going to share some of them in a few minutes. Click, please. In relation to the type of social protection instrument used to respond, and here we're just focusing on social protection. Of course, there are other responses typically implemented by civil protection, and then other sectors like health and so on. We are focusing only on social protection here. And so by type of social protection instrument, the most frequently used has been non-contributory cash transfers. There are a few reasons for this. First reason is related to the benefits of transferring cash. Cash is associated with enhancing dignity, empowerment, with giving flexibility of choice, with boosting local economies. So there are a series of benefits that make this type of response attractive. And then on the other hand, non-contributory cash transfer programs, and in particular conditional cash transfer programs, they have been expanding a lot in recent years, and governments have strengthened the administrative capacity in line with that expansion, and therefore this creates a lot of opportunities for emergency response, and this may be one of the reasons why they have been selected. The other type of program that has also been used in a few cases is the other school meals programs, and we know that these programs are very important in the region with wide coverage, and therefore they are a sort of a platform for delivering support in emergency as well. And then there are other types of programs like public works, social security, subsidies. I'm going to share some of them with you that have been used, not as much as the others, but there are some experiences to share. Next slide, please. Okay, so now by type of response. So first, it's important to mention that in Latin America and the Caribbean, responses are mostly led by governments. Almost in every country, this is what happens, and this is different from other regions. And sometimes the global debate focuses on the coordination between humanitarian aid and national governments. In Latin America, responses are typically led by governments, and humanitarian aid provides financial, technical, and other type of support. And responses through social protection, they, as I said before, they complement other type of responses. Click. The most common type of responses, going back to the theoretical framework, are the vertical expansions, the horizontal expansion, and the type of piggybacking. Next slide, please. And now I'm going to share with you some experiences. Let's start with vertical expansion and cash transfers. Click, please. There are a number of different experiences in this area. I'm not going to go into details here, but let me just mention the most recent one, that in Peru, and the government expanded vertically the programs, the cash transfer programs, Pensión 65 and Juntos, earlier this year in response to flooding. There are other experiences you can see in Chile, Brazil, Mexico, and other countries that I'm not presenting here. One thing to keep in mind with vertical expansion of cash transfers is that one risk is that when transfers are increase, those temporary increases can become permanent. No, so it's important, and this is what evidence shows. It's important how this is communicated. And next, vertical expansion. Click, and school meals. Click again, please. While school meals have also been used for the delivery of food assistance. Click, please. And there are examples in Nicaragua, Honduras, and Haiti of programs expanding vertically and giving additional rations of food and providing meals during school breaks. Next slide, please. In addition to vertical expansion, again, now trying to see other experiences using other types of social protection instruments. We can see the use of social insurance in Uruguay and Brazil by extending the duration of benefits. Social insurance is not that frequently used precisely because of the coverage of these programs and because of the high levels of informality in the region, but in any case, there are some experiences, as you can see, and the same with social pensions. Next slide, please. Click. So now we move to horizontal expansion, cash transfers. In Mexico and Chile have expanded the cash transfer programs in response to emergencies. It's also one of the risks, a risk and an opportunity with horizontal expansion is that when expanding, there coexist permanent or long-term beneficiaries with temporary beneficiaries, and that can create tensions. And if it's not communicated properly, then these temporary expansions may become permanent. This is a risk, but it's also an opportunity, because in some cases, programs have managed to identify households that were already eligible for the program, but for some reason they were not in the program, and so this vertical horizontal expansion were an opportunity to bring them to the program. Next slide, please. Public works have also been in some cases designed and implemented exclusively for responding to emergencies, like for example in Argentina. In other cases, there are more permanent programs that are set up to respond to shocks. Next slide, please. Now, in terms of piggybacking in relation to cash transfers, and I guess that Francesca is gonna share with you this in a few minutes. But in Ecuador, in response to last year's earthquake, the government and WFP implemented a response that piggybacked on the systems and the administrative capacity of the ministry in charge of implementing social assistance. So the program that assisted people affected by the earthquake was a different program, separate from regular programs, but piggyback on existing capacity of the ministry in charge of social assistance. Next slide, please. Click. So now we move to preparedness. And the first thing that we can say is that social protection systems have been designed for objectives different from emergency response. Going back to the diagram that I presented at the beginning, they are typically designed with objective of reducing chronic poverty or providing support across the life cycle, not for emergency response, but that doesn't mean that they haven't played roles. They have played important roles, and I just share with you some experiences. Click, please. Since the objective has not been to respond to emergencies, the planning and preparedness ex ante previous to the shock has been limited. Click, please. And in general, responses have been more have used systems as they were, or only with small tweaks. Click, please. There has been limited coordination between social protection and civil protection ex ante in terms of preparedness, and this limited coordination is of course related to the fact that social protection hasn't been conceived as a system for responding to emergencies. Next, please. And another large finding is that more mature social protection systems are able to play stronger roles in shock response to social protection. What do we mean by this? Systems with greater coverage, with stronger systems and processes and data, with a variety of services provided and so on. They provide more opportunities for emergency response. No? Click. So despite that these systems haven't been created for this purpose, and there has been limited preparedness ex ante, there are a number of experiences that are worth sharing, and there are a number of opportunities that are worth sharing, and that's what I'm going to do now. Next slide, please. Okay, preparedness, we said that we focus on targeting, delivery, and coordination and financing. Let's start with targeting. Click. So social registries can contain data useful for targeting in emergency response. click please. So as I mentioned before, social registries have information about beneficiaries and non-beneficiaries, and they typically have a lot of information related to socioeconomic characteristics of households. And this data can be very useful in response to emergencies. And for example, let me give you the case of the Dominican Republic. The social registry in Dominican Republic is called SUBEN, and as part of the SUBEN, there is what is called IVAC, Índice de Vulnerabilidad ante Choques Climáticos. There is an index that estimates the likelihood of a household being affected by a climate shock, and also the system. So households in the IVAC and in the social registry are georeferenced. So the government has information that allows them mapping every household with their characteristics, number of members, and so on. So when they know that there is going to be a climate shock, they can prepare the response based on this information. That is, of course, very useful. Next slide. Click. So then another example, just to show that even though social registries contain information from before the shock, and the shock is likely to affect the socioeconomic characteristics of households, and so that data will need to be updated at some point. It still has information that still the social registries have information that is very useful. And for example, in Ecuador, 66% of the people affected by last year's earthquake were already in the social registry. So when 66% of the people register in the registry of affected households, were already in the social registry. This percentage comes to 80% in the case of Peru with the recent flooding, and in Chile to 92%, we have been informed recently. So this shows that most people that are affected by shocks in these countries, they were already in the social registry, and government had quite a lot of information about them. This, of course, depends on the type of registry, the magnitude of the shock, the type of shock, and other things. But we're just showing that in some cases, the overlap targeting, no? And let me give you an example. So in Chile, there is this form that is called FIBE that is used to collect data and to register those affected by a shock. And this data is implemented by local authorities, but the one in charge of this form and the database and the targeting and so on is the Ministry of Desarrollo Social, of Social Development, and the reason why this is the ministry in charge is precisely because they have a great capacity at local level, and they have a number of agreements with different municipalities, and they had to create this capacity in order to implement the many programs that are implementing, no? So this capacity at local level that social protection programs have, they create an opportunity for targeting and other kind of opportunities in relation to shock response, social protection. Let's move to the next slide, please. Okay, so now we move to delivery, the second system within preparedness. And most large social protection schemes in the region rely on electronic payments. Not every program, not at all, but most of them. And one of the reasons is that there is a wide coverage of the banking system, in particular the public banks, that allows programs reaching remote areas that are fairly remote. There are only few experiences in relation to mobile money and not of a still small scale. Click. And then school meals, as I said before, given the coverage, they provide a platform and an opportunity for delivering humanitarian aid, not only in-kind aid, but could also be cash assistance. Click, please. Click. Now we move to coordination and financing. So there are different experiences in different countries, of course, but there are a number of interministerial and interinstitutional committees that are meant to improve coordination ex ante. Some of them are stronger than others, and in some of them, social protection plays a stronger role than in others. But there are these committees in different countries, and they create this opportunity for improving coordination. Also, national emergency response strategies, they define the strategy and they define roles and responsibilities. In some cases, social protection, like for example in Chile, it plays an important role in this strategy. In other cases, that's not the role that social protection is given. But these national strategies, they are a platform as well for defining roles and responsibilities and improving coordination. In relation to another point of coordination between social protection and other sectors, and in particular civil protection in preparation for an emergency, is the fact that given the capacity that I just mentioned that social protection programs have at local level, they can be used to deliver civil protection information. No? Click. So let me just give you two examples in relation to the point that I just made about delivering civil protection information. Prospera, that is the flagship conditional cash transfer program in Mexico, delivers civil protection and information and training to beneficiaries and communities. So it's used to deliver that kind of information, and this improves coordination ex ante between civil protection and social protection. And then SINAPRED in Nicaragua is one of those interministerial coordination bodies that I was just mentioning. Click, please. In terms of financing, financial mechanisms for emergency response are fairly underdeveloped, and emergencies tend to be financed with ex-post strategies. The most common one is the reallocation of resources, or the second one is international support or financial support. However, there are some interesting experiences in relation to ex-ante financial mechanisms. Click, please. One of them is the CRIF, that is a parametric insurance in the Caribbean, that there are 16 Caribbean and Central American countries that participate in this CRIF, that pays countries an amount of money predefined based on the type of shock and other parameters after the shock. No, so for example, in the case of Haiti received $20 million after Hurricane Matthew in 2016, and 7.7 million in 2010 after the earthquake. No? There are other ex-post strategies in the region, like for ex-ante, like for example, El Salvador and Dominican Republic, they have contingency loans with development banks that they get activated when there is a predefined shock. Next, please. Okay, so Some final remarks to wrap up. Okay, so what I have shared with you brings us to a number of or a few main conclusions. The first one is that social protection coverage and administrative capacity offers a number of opportunities. I have presented about social registries, about payment mechanisms, about delivery platforms from cash transfers, but also school meals. I have presented about the capacity of these programs at the local level that brings a number of opportunities. So the first point to make is that social protection coverage and administrative capacity creates a number of opportunities for emergency response. Click, please. So the second one is that social protection systems and programs, they have been used in emergency response. So we can see a number of experiences. No, they haven't been designed for those for that purpose, and they haven't been adapted substantially in general ex ante, but there are a number of interesting experiences. Next, please. And effective responses and stronger responses will require ex ante planning and preparedness, and this is why we make a lot of focus on planning and preparedness prior to the shock. Next, please. And if there is a role for social protection to play, and this is, I mean, every country needs to decide based on its own context and objectives, but if social protection plays a role, this needs to be a role within a wider response strategy and disaster risk management strategy, and social protection will play only one role, and there are a number of other very important sectors that will play other roles. So this national social protection, national emergency response strategies are the platform for defining these different roles. I think that this is it. Next slide, please. I think just a thank you slide. Yeah, exactly. So, well, many thanks for your time. Now we are gonna move to Francesca, who's gonna present about WFP's role in shock response and social protection in the region, and then there's gonna be an opportunity for you to ask questions, and I'll be happy to answer to them. Many thanks. Francesca, on to you.
Thank you very much, Rodolfo, for a very comprehensive presentation of our study. I think the organizers will switch to my brief presentation here. The point is really to complement some of these insights from the study with some examples of WFP's role in particular in supporting shock responsive social protection in Latin America and the Caribbean. Maybe next, please. Just to start off, I wanted to just highlight with this infographic something that is quite important for WFP and for WFP's role in general in Latin America and the Caribbean region, where social policies are very advanced, and also emergency management mechanisms by national disaster management agencies. So really the role of WFP here is to work with the government and institutions. It's mostly a middle-income country context. It's quite a different position or view of what WFP does maybe in other parts of the world, we have shifted also since a while to a stronger focus on cash-based transfer mechanism that now represent about 50% or more than 50% of our direct assistance. But more than what we do directly, it's really realizing that the platform provided by large-scale national social protection programs and systems is a unique opportunity to contribute to the different SDGs, right? And here it's written 90 million people, but this is only based on the countries where WFP has an operational presence, which are 11 countries in the region. However, we could say that 200 million people are covered only by safety nets, only by non-contributory social assistance in the region. So clearly this is an opportunity for any of us partners and allies of the governments to support food security and nutrition in our case, but also disaster management and response. This is really one of our main areas of work in the region since a while, not only at the theoretical level and trying to generate the evidence with Oxford policy management, but also more at the practical and operational level. It really, in the end, relates to the global commitments that WFP and other partners took to support the Agenda 2030, the Sendai framework, the World Humanitarian Summit commitments, and therefore really move forward this agenda, particularly in a region where this is definitely, it creates all the conditions are all there to really link and support the humanitarian development continuum. Next, please. Just here some pointers again on what we do in the region and why did we engage in the study and in this role. It's not so much as it might be in other contexts to have a platform in order to channel WFP assistance through the national social protection systems. Yes, also when and if that is needed. However, it is rather really to foster a national response through the social protection systems when this is a priority for the governments and really for the both institutions involved normally at the national and local level, which is the social protection institutions on one side and the national disaster management agencies and civil protection on the other side. So this is why the study and also lots of our work is not so much about WFP, but of course WFP whenever possible also complements the response of the governments using the same system, which is most of the times most cost efficient and also then setting up a parallel humanitarian assistance intervention. Again, the stressing what Rodolfo mentioned, we really hope to focus more and more on the system preparedness, and preparedness in general for emergency response has been a big area of work with many sub-regional institutions, but also governments. But here it's about the system preparedness of social protection, of that part of the system, and there we still have a long way to go, as we have pointed, I think, in the study. We work with a strong focus on interinstitutional coordination on the different actors at both the national central level as well as subnational level, and clearly on partnerships, because this involves not only government and non-government bodies in each country, but also other actors are very involved in this, and we are joining forces more and more with partners such as the World Bank and UNICEF and UNDP, who are very involved and really trying to create a common vision on shock responsive social protection in the region. Hence, we certainly act at country level, which is our country offices are really on the front lines with the partners and the governments there, but also at a sub-regional level, for instance, with institutions such as SEDEMA, the Caribbean Disaster Management Agency, or its a similar counterpart in Central America, etc. As well as regional level, and the seminar or conference that Rodolfo mentioned that took place just at the end of October in Lima is an example where 20 governments, including from other regions of the world, came to discuss and share experiences in shock responsive social protection for the first time at this scale and level, and it was seen as a very good move towards South-South cooperation in this area. So we continue really with an advocacy role and evidence generation role. This is not over. The study highlights many gap areas that we hope to continue digging and systematize, but mostly we really want to link the research and the policy to the practice. Next, please. So here I'll take a few minutes on this slide. To give some examples of WFP role, I think some were already mentioned. Some of these have a specific case studies with details done with OPM, so we hope you can read there. But briefly, some different types of roles and actions that WFP took to support shock responsive social protection in the region. Ecuador is probably the most renowned example. It was in April 2016 when the massive earthquake struck the country. In this case, WFP's role was to support the government first on the first humanitarian assistance in the first few days, complementing the national-led response, but also to start supporting the decision-making process about whether and how to use the national social protection systems, in particular the delivery mechanism of the Bono de Desarrollo Humano, to deliver cash transfers to affected families. And then in a second phase, when this decision was already taken by the government, WFP also complemented with resources and joined forces in one multiple bono or transfer that was called 3A. So it was for food, alimentación, alquiler, which was for rental, and acogida, which is for the whole families who were not directly affected, but they were hosting affected families. So they received a cash transfer from the government. WFP's role in this one was for the bono de alimentación and of food, and also in rural areas, and provided $100 for 3 months to the affected households, accompanied by nutrition information and also helping to reactivate the local markets, which was one of the priorities of the government at that time. At the same time, WFP also provided and other partners provided technical assistance on targeting, on monitoring, and several other areas of work then after this experience emerged with the Ministry of Inclusion and Social Affairs and with the entity in charge of national disaster risk management in order to support the preparedness in view of future also disasters. So quite a well-documented experience and certainly very, very interesting. Moving to Haiti, of course, a very different context and also different role for WFP in the only low-income country in the region, but shock responsive social protection, we could say it's one of the core areas of WFP work since a couple of years and a little bit more, really focusing on different levels. One is at the policy level. So WFP and other partners are supporting the development of the first national strategy for social protection, which embeds shock responsive approaches in the normative framework since the start. So this is quite an important work. Secondly, at the institutional level, working really closely with the MAST, the Ministry of Labor and Social Affairs in Haiti, and really strengthening institutional capacities of MAST to have a role to participate and to support the emergency response. For instance, in the response to Hurricane Matthew in 2016, MAST teams trained by WFP went out to help on the assessments and on the data collection of the families affected. They co-led also the cash-based transfer working group, etc. Thirdly, there's a more operational role that also WFP has in partnership with CARE and other partners that are leading the Corelavi program, safety net program and consortium, and established WFP also a mechanism for shock responsive strategy in case and expansion in case of crisis. So very interesting developments there as well. While of course the social protection system in Haiti is still nascent. Nicaragua, on the other side, as Rodolfo mentioned, we wanted to just share a different type of crisis, a slow onset crisis, a Niño-induced drought for several years in a row in the whole Central American dry corridor. Here, the government has a very large-scale national safety net program, which is the National School Meals Program, and decided to prioritize the expansion in the dry corridor of this program during the critical months of the year in in several years in a row, 3 years in a row. And WFP's role here was really to accompany and support the government in this, particularly in 2016 and also in 2017, providing basically an additional extra meal to the children in these areas as an additional safety net and avoiding dropouts from school. This is part of a broader regional and multi-year program supported by the EU, which has a focus on resilience in the dry corridor. Next is Peru, again a very different context, upper middle income country where WFP has no direct delivery or direct assistance interventions, work really with the government at technical assistance level, particularly with the Ministry of Social Development and Inclusion. Peru was hit by devastating floods this year, again following the El Niño phenomenon, and here really WFP joined forces with the government, but also with the World Bank and UNICEF to support the decision-making about of the government about the types of response possible and how the social protection system and programs that are very advanced in Peru could have a role. So there was a Congress hearing with the parliamentarians about this topic where WFP participated, and later on in many different other forms WFP accompanied the government, but without a direct support or resources in this sense. This strategic partnership with WFP then also was a stepping stone towards the regional seminar that was organized there recently, as we said, with the Ministry of Foreign Affairs and the Ministry of Social Development and Inclusion. In the Dominican Republic, just briefly, it's also featured in one of the pictures, WFP is investing a lot on this topic as well. We're working already on both disaster risk reduction as well as social protection, particularly on the nutrition component of the program PROSOLI, Progresando con Solidaridad. So WFP and partners have engaged with the Vice President and her teams to really see how these large programs could support emergency response and signed agreements so that we could be prepared in case WFP needs to complement the national response, and using the ADES, which is a network of retailers all around the country in order to provide assistance to affected population. At the same time, WFP is also working on with a social plan of the presidency and local social canteens that are all over the country as well, and providing meals during normal times as well as during emergencies. So quite an interesting study and case study with OPM also available here for those interested. And finally, just a note on a very recent or ongoing actually experience in Dominica, in the Eastern Caribbean. WFP does not have presence in Dominica, but thanks to pre-deployment of staff and teams in islands, while the set of hurricanes that were hitting the Caribbean were passing through, WFP was able to deploy very soon and work with the government side by side with many partners in distributing first assistance for in-kind, higher energy biscuits and other types here. Right now, this was after the passing of the Hurricane Maria. I don't know what happened to the screen, but I'll continue. Basically now, thank you, we're discussing currently with the Ministry of Social Services, Family and Gender Affairs and with UNICEF a plan to use the existing public assistance program, PAP, that normally provides support to poor families, to provide an emergency cash transfer to 8,300 more or less households affected, and this one is complemented then by UNICEF with an additional emergency well-being child grant, and this is all of $50 per child. So this is really piggybacking, using and expanding both vertically and horizontally the national social protection system in one particular program, we hope to document this experience and this plan in the next few months and share with the broader community for also learning in a very different context where, again, 90% of the population was affected by the massive destruction following Hurricane Maria. Next, please. And just last slide here to conclude a little bit from WFP's perspective, although more above and beyond that is really recognizing all of us that work in this area, the challenges that exist in shock responsive social protection. No matter how promising this agenda is, we need to be realistic and practical. It's not a silver bullet and not always the best option. For instance, if it's overburdening national systems, nascent systems, or programs that don't manage maybe to yet comply with their main mandate, etc. However, the opportunities are many. Even in this emerging agenda, we need to look forward more in the future, I think, to new frontiers and issues that have not been tackled necessarily yet, which is going, for instance, beyond natural disasters and looking at different types of crises in the region, like human mobility crisis, migration, violence, urban context, lots of other topics that need to a specific lens on this, and to understand better the opportunities and difficulties. One of the challenges is clearly the coordination, as we said, and the financing mechanisms, and even there we need to think a little bit out of the normal mechanisms, and we hope to engage on this insurance, risk insurance mechanisms, and see how payouts from sub-regional mechanisms could be used through and channeled through the social protection systems, for instance. Another issue is really, basically about WFP reiterating its global and regional commitment to follow through all the initiatives, the regional initiatives, but as well continue generating evidence and informing decision making, and particularly the practice. The focus will continue to be, and even more, on supporting social protection system preparedness and joining forces with the key partners that can best help governments in this direction when and if this is appropriate. Basically, just to conclude, really, WFP is standing by something very clearly stated in the Agenda for Humanity, which is the need to move really from delivering to ending needs, and three fundamental shifts that I can quote, and that are written there, which is to reinforce and not replace national systems, to do not wait for crisis, but anticipate them and transcend certainly the humanitarian development divide. So thank you very much, and we're available for questions, and this is of course very relevant topic for WFP and for the Latin American region. Thank you.
Thank you so much. Thank you, Francesca. Thank you, Rodolfo. I don't know if you'd, I think it would be quite nice if we were all available for questions now with the video open. So I've been receiving a really interesting set of questions, and I want to kind of embed them into the kind of key themes that have been emerging from what you've been discussing up to now. And I think one emerging theme is that there's a huge variety of experiences kind of from across the region. Kind of individual countries have been approaching this kind of in a very ad hoc way, and they've kind of been finding their own systems to address the issue of trying to respond to shocks, ideally through these quite strong social protection systems that they have. And many of these experiences have shown the importance of these design tweaks, kind of how these that in terms of preparedness, that design can be tweaked in order to better respond. And just to mention that conceptual framework that we presented at the beginning, that takes from it's kind of building on the DFID global study that we've been conducting on this, that framework will actually be changed, and there'll be one of the elements of the framework will actually be this design tweak component. Now, the second key theme is the theme of the strengthening of systems, the importance of the institutional capacity in the background. And that's something that, from the questions, it's obviously worrying people from other sides of the world, where they're saying, what if our contexts are incredibly different, if we don't have that capacity, if we don't have those social registries in place, those administrative systems? You've talked about large capacity and kind of relationships built over time with municipalities, with the, for example, kind of very often the response there's a big lead taken by local municipalities, and those are relationships that are built over time, and including wide coverage of the banking system in terms of a response. So what about other regions? We had one viewer, for example, saying kind of in Africa we don't have all of this. What should we be thinking about and doing? I can just mention that there's more experiences and more evidence coming from Africa and other regions as well from the global study. The synthesis report will be out soon. There's evidence already on the OPM website on this. We can share links, and there's an online community on socialprotection.org on social protection in crisis contexts, kind of in how social protection can be used in case of shock. So there's a lot of evidence there, and of course on we had a couple of other people asking about where all of the evidence that you've been discussing can be found, and there's a web page on the WFP Latin America page and on the OPM website. We'll be sharing links, so you will have all of this information available. So question number one is the one about what about other contexts. We have a second question about social registries, how to create them, whether those social registries you mentioned with very high overlap, whether they were covering 100% of population. And I'll answer that briefly while I give you time to think about the question. So I'll answer in a minute. There's another question about the timeliness of some of these tweaking, kind of how, whether that guarantees timeliness. And this really touches upon one of the core trade-offs kind of which governments face in these situations, which is between responding in a timely fashion to a disaster and for example, kind of being able to avoid exclusion and inclusion errors. So, I mean, the only way to avoid inclusion and exclusion errors is to do a full re-registration, but that can take a lot of time. So Rodolfo can go into that a little bit. A really interesting question about examples of countries that have been developing strategies and operational plans so that to actually institutionalize the use of social protection in shock response and kind of embed it in a more stable manner in government systems. And I think Rodolfo, you could touch upon the Chile example, and I'm sure you two have more to discuss. We've got another very interesting questions about response to regular seasonal shocks. So, for example, in Latin America, those could be the shocks that we see in the dry corridor up in Guatemala and other countries. So, whether some countries have created approaches that can increase the predictability of response, or that can be triggered kind of based on climatic conditions to increase predictability of response. I think I'll stop the questions for now. I'll do a second round, and I'll quickly answer on the registration of the social registry one while you gather your thoughts. So on the social registry question, I don't have the exact data for Peru or Ecuador, but I know that in the region, the coverage is between 43% kind of in Brazil and Mexico is slightly higher, kind of all the way up to the only country with 100% coverage of a social registry is Uruguay, and very few countries around the world actually have that level of coverage. Chile, for example, where Rodolfo mentioned the coverage in several cases was up to 92%, has a 74% coverage of the social registry. So why is that overlap so high? Because often the poorest and most vulnerable do tend to be the ones who are most affected by disasters. So that's just something to keep in mind in the background. So I'll hand over to you to answer some of the other questions I've started posing.
Okay, thank you. Vale. Okay, so briefly, and then I'll also let Francesca take some of the questions. So in relation to other context, yes, of course. I mean, that's why at the beginning of my presentation, we started with this idea of Latin America being exposed to shocks, but on the other hand, having relatively advanced social protection systems, and that this fact is an opportunity for emergency response, no? And that's not the case in every region and every country. And the whole idea of shock response and social protection is building on what is already there, no? And so of course this will depend very much on the context and the countries, and the countries that they don't have social registries or they don't have a capacity at local level and so on, no? There are a number of studies that are available, and we'll also send the link afterwards, in Africa, Asia, and we know that there is ongoing research, so there is going to be more evidence. In our case, we just focused on Latin America, and this is the context. But I mean, the short answer would be yes. I mean, depends on the context, and we don't want to provide findings and recommendations that are useful for every context. I don't think that's possible, no? So it depends very much on the context. So I would suggest to go back and check the other case studies as well. Then, in relation to timeliness of kind of tweaking the design of programs, I mean, this is a crucial aspect, no? First, I mean, there is a, I mean, experience so far has shown that there is a sort of window for tweaking some of the systems exposed and during an emergency. And what do I mean by this? I mean, in many cases, the first response is not implemented by social protection, no? Would be typically, at least in the region, would typically be civil protection, and even more in rapid onset disasters would be civil protection and other sectors, no? And so on, this gives a window for systems to get prepared. Could be a few days, could be a couple of weeks, no? Of course, the more prepared the system is ex ante, the easier it's going to be to do these changes ex post. But then there is also this issue that we cover in our study of a kind of a need for a new mentality in the social protection sector. That in the social protection sector, we tend to be very concerned about inclusion errors, for example, or conditionalities, and so the other things that are very important in social protection, in particular in social assistance. Yeah, but when responding to an emergency, and when we put kind of the civil protection hat on, then we may need to accept certain inclusion errors because the priority is to reach as many people and as fast as possible, no? So this sort of trade-off between inclusion errors and reaching people as fast as possible are things that social protection systems will face, and they certainly face in the first days after a shock. So in part of the preparation, the planning for responding to emergencies would be important that social protection systems start engaging with these new ideas and new principles behind responses to shocks. The same, for example, happens with conditionalities. No, conditionalities are very important in conditional cash transfer programs in Latin America, are not necessarily suitable for emergency response. And very, very quickly and briefly about regular seasonal shocks. Yes, I mean there are a number of experiences in the region. I mean it's recurrent and slow onset shocks tend to be less visible, no? So there is there are not as many experiences, but there are, and then what is also important is to find a way to define how and when the social protection system kicks in, no? And when a situation that is worsening gets to a point in which social protection needs to provide certain support, and we haven't seen many experiences in the region in this regard, no? But I mean, in a rapid onset disaster is quite clear, no? But or clearer, let's say. But in a slow onset one is not that, no? And so this is where social protection and civil protection can coordinate better, and social protection can use information and from civil protection to define when certain support, certain predefined support is required and provided. I'll pass to Francesca, and then well, we'll keep answering. But yeah.
Thanks. Just to complement and maybe start from this last one, that certainly is one that we often discuss as WFP is really focused on food insecurity. So about seasonal shocks and how these and the ability to make the transfers that are much more dynamic and flexible depending on the phase of the year, depending on the lean season, etc. This is one of our major sort of concerns, that it's really out of the agenda. It's not so much considered a shock sometimes, but it is really where people are pushed down regularly back into the development progress. So it's really very, very important to tackle it. I think that in the dry corridor of Central America, with different approaches, more resilience building approaches linked as much as possible to social protection systems, this is where we really need to look at that. It's really about also not only just to use the system, but also to change the transfer levels, all the frequency, etc., to meet heightened needs in certain periods of the year. So I think that from a food security and a nutrition perspective, certainly this is a very top priority to look at, and it is reflected also in our studies, because we had a lot of discussions on this and how normally it's really tackled a lot by the ministers of agriculture sometimes, and not.
You're disappearing, Francesca. You've gone silent.
We can't hear you, Francesca.
Okay, now it's restored, it says. Sorry, well, it should have, there should have been at least one glitch, no, along the way.
Yes, of course, it was going too well.
Okay, I'm back. I don't know what you've heard about the seasonal part, a little bit?
The first bit, yeah.
Okay. So I moved to the other consideration, which is really all these questions about timeliness, accuracy, levels of transfer, and why and if and when to use the system is about what are the benefits for the people that are affected, and why use it. It's not just it makes sense, but in which sense? Okay, so timeliness and efficiency in the response. The cost factor is another one that we would need to look at very much in detail. Is it lowering the cost and making more efficient the use of resources, of national and international resources? This is, for instance, in Ecuador was clearly the case. So it's a very good argument, let's say, and also people are used to the system. It's easier to communicate about it. People know how it works and how to relate with the local workers as well. I think there's lots of points of views where we can look at it from the benefits perspective, and I think the timeliness issue is really where there's the biggest maybe clash between humanitarian type of approach and a more social protection one. Social protection wants to be rigorous and precise and limit as much as possible the inclusion error. In the case of the humanitarian response, we know that the biggest consequences of not acting in the very early phases are vast, on nutrition, on the children, on protection, on various issues. So normally humanitarian actors, when they do parallel interventions, they go as fast as possible, accepting certain level of inclusion errors and then tweaking and adjusting the targeting system as we go ahead. And that is something quite difficult to do for governments who are, of course, politically exposed, as well as resource constrained to include or to think in a different way. So we're collectively, I think, thinking about the trade-offs of these approaches, and clearly with the third and last comment about the institutional capacity and how we do in different contexts. Clearly, yes, it's true that the institutional capacities might be lower or the systems might not be so advanced, but there are million experiences in the person asking the question from Africa, I don't know which country, but from Africa itself, where the national system, social protection, was built on a risk management approach and on shock responsiveness, like in Ethiopia, like in Kenya, and many other very good examples. And also there, the role of international actors like the World Food Programme and many others, is exactly, and we do have the duty and responsibility to do that, to set up interventions and transfers that in that moment are needed and to support people, affected people. So if the system is not there, you still need to do it, but in a way that can be then later picked up and used as a basis for a national system. So in your framework, this was called a shadow alignment, I think, but there are opportunities, and if you set up a very cumbersome, very UN-esque type of process, it's very hard that this will ever be a basis for a future safety net. So I think that WFP and partners worldwide are really changing minds and shifts. It's a big change for us as well, I must say, in order to create those conditions that are necessary for shock responsive social protection to be useful. Over.
Fantastic. Thank you very much, guys. Very nice, concise answers. I thank you for that. So that gives us time to kind of for one last kind of brief round, and this time I'll just fire smallish questions at you. The biggest chunk of questions is around some of the insurance financing mechanisms that you mentioned, and the CRIF in particular, and how those relate to the immediacy of response. So, for example, is the money being passed through governments and then being given out to people? Are they going to people directly? How fast kind of do they actually kind of get into action? Then there was, I think I'll skip, there was a further question on slow onset, but I think you've partially answered that already. We can answer kind of in writing kind of at the end of the webinar if you feel we haven't addressed your questions. There's one question on the gender dimensions of shock responsive social protection and whether we've addressed those in any way and what our thoughts are. What kind of your personal thoughts are on the waiving of conditionalities, given that there is research showing that even a kind of a temporary pulling out maybe of a child from school can have kind of longer term effects. And one question on tackling corruption at local level. So, I mean, you might not be able to answer everything, but we will answer in writing if you feel we haven't addressed your question. So I'll hand over to you for these last few questions. Thanks.
Okay, thank you. So let me start with the insurance question. So in the case of CRIF, money is transferred to the governments, and it's not necessarily for social protection. The governments can use them as they see fit. No, it's just, I mean, it's a predefined amount based on different scenarios, and it's transferred quite quickly. In a couple of weeks, the government has the money available, and it can be used for whatever they want. CRIF doesn't put any conditions on what it should be used. Now they are trying to set up a mechanism for monitoring on what has been used, but more for having information and understanding how countries use these funds available, but not as a condition, let's say. In terms of gender, yes, a very important issue. I mean, in our research, we discussed this at the beginning, and we, of course, put on the table the fact of having a gender perspective and understanding the gender implications of emergency and responses. We haven't, due to the coverage and the scope, let's say, of the research, we haven't managed to cover gender aspect as we would have liked. In a sense, they are also very related to how gender, the gender dimension is taken by social protection systems and other systems as well. No, there are some systems that are more prepared and are more and consider more gender dimensions, others that don't, and those things tend to be reflected when social protection systems are used in emergency response. But this is not one of the dimensions that we have focused on, although I think Francesca mentioned before there are a number of other dimensions that there is a need for research, like resilience and so on, and one is for certainly gender. Also children, I mean, would be good to conduct some research to understanding how children are affected by shocks and how social protection can support them. No, And my final answer, and then on to Francesca, in relation to waiving conditionalities. The experiences that we have found in the region is that, I mean, conditionalities tend to be waived not because there is a kind of a rule. In some cases there is, but overall, I mean, there aren't rules that define that when there is a shock, the conditionalities are or should be waived, but this happens naturally also because programs don't have the capacity to verify conditionalities during emergencies, no? So they simply just, either because it's a decision from the program or because they don't have the capacity to monitor the conditionalities, they are waived in practice, no? But I mean, some programs, and we have heard from governments in the Lima conference, are trying to put this in the program rules and make clear about how and when conditionality should be waived and for how long and so on. So it has happened in practice, but it's in general not part of the program rules, no? Francesca, do you want to share your views?
Sure. If my mic works, I'm happy to. So yeah, definitely very good points raised. I think interesting because they were certainly some of the discussions we have had several times with OPM on gender. Really, we noticed, of course, a very big gap in. More than a gap, we really thought that needed a specific attention. So from the WFP side, we have developed a paper we can also share with the materials, which is gender-sensitive social protection for zero hunger. It's not focused on shock responsive only, but a large part of it also addresses and gives some ideas in terms of what could be done and really how to embed and mainstream gender best practices worldwide within both areas, in the social protection and then use them during the emergency, but also in the emergency response, preparedness and response arena. And there's so much learning worldwide, and in terms of the actions that need to be taken in consideration by the different actors, I think that this would need to be one of the key pillars of any protocol, of any considerations in terms of programmatic decisions taken, and considerations also very related also to the conditionalities, also to the protection issues and other several factors that are crucial in the first phase of the response, but also later, not only. So indeed, a very good point taken, and we're looking at different options there. And just a note on the conditionalities, again, agreed basically with Rodolfo. Personally, and I think WFP in general, believe that especially in the first phase of a response, you need to keep things as simple as possible. And if the administrative system and conditions and program rules are overburdening and difficult, they won't add any value. It's the opposite, the other way around. And also, we need to recognize the growing amount in global evidence about giving unrestricted, unconditional, let's use a lot of lingo here, but multi-purpose cash transfers in these cases that do meet, let's say, let's take a case of a sudden onset shock where large segments of the populations are affected. They do meet better the needs of the population to decide whether they need what do they need most in the first phase is a package of basic needs that needs to be supported. And I think that in this view, WFP is really moving towards that whenever this is possible and whenever the government has a similar approach. And shock responsive social protection gives that opportunity to provide different types of support and services. And indeed, the conditionalities can be reintegrated later on if this is a key component for health and nutrition reasons or others of the safety nets programs. But for the temporary scale up or expansion of the safety net, it is probably not practical in some ways. Thanks.
Fantastic. So I have received a couple more questions in the last minute, but I don't think we'll be able to cover those given we've come to the end of our session. But as I said, we will be emailing you kind of following this webinar with links to all of the relevant websites, the Global Community of Practice from socialprotection.org, and kind of, so you can actually kind of dig into more depth into the case study materials and reports, because there's a wealth of evidence there that we haven't managed to cover in this last hour. So join me in thanking Francesca and Rodolfo for their presentations, and thank you to all of you who attended and kind of stayed all the way to the end to the questions. I'm very impressed with, with your persistence. I mean, it's obviously a very relevant, important topic, and Latin America is, from certain perspectives, it's ahead of the game. So it's an very interesting region to be looking at in terms of kind of where might other countries kind of be next, just in terms of that the depth of the capacity, especially at local levels of administration. So thank you everyone for joining, and yes.
Thank you very much to everyone.
Thank you.
Thank you. Bye-bye.
Bye.
Bye. ¿Cómo se hace ahora?
O organizador